Hey there, my name is Caden Sager, and I have spinal muscular atrophy type 2, which is a genetically inherited neuromuscular disease that affects the nerve and muscle connections in my body. I have 39% of my lung capacity. By the time I was 5 years old, my spine had curved to a 79-degree curve because of muscle imbalances, so my back was rotted at that time. I've been ventilated from lung collapses with numerous procedures. Long story short, I've been in the hospital quite a few times. I just recently graduated Hopkins High School, where I graduated with honors. But aside from my life and my impairments, having SMA has given me a very unique perspective in regards to being a patient and an advocate for myself and others. Being a disabled patient is a challenge with regards to physician interactions, as disabilities can really make physicians uncomfortable. As a result, disabled patients have to often put in this extra effort to be recognized as individuals and not just extensions of their diseases or accessories to their parents and guardians. But thankfully, I've been blessed with genuine and kind-hearted doctors who have made the extra step to make sure that I have a voice in my treatment, something rare but needed when receiving care as a disabled patient or as an ordinary patient. The residents I've met with from the patient program expressed an interest in learning how to accommodate disabled patients like my doctors have so far. Their willingness to learn and adapt was refreshing, and for me personally, a source of relief. It's good to know that the physicians of today and tomorrow are interested in doing their best to treat disabled patients with the same level of respect, care, and attention that they give to the average patient. That's really all we want. Good patient care towards the medically disabled includes, in my personal experience, many things. For example, communication between physicians and their disabled patients is, in my personal opinion, at the utmost level of importance to the quality of care and experience for their patients. Being addressed and included rather than being ignored and essentially invisible is something that disabled patients really desire. Another aspect of care that is essential for disabled patients is preparation for medical care in the future. For me personally, this has more recently become clear as I'm moving towards this transition from child to adult care. When physicians actively try to make this transition smooth, it makes life a lot easier and more stress-free. Today, the medical treatment system generally lacks personal connections between physicians and their patients. It's seen as a weakness and a liability rather than a strength. Unfortunately, in this wave of time efficiency and cost-cutting initiatives, this connection between doctors and their patients is strained. As a result, patients are often left feeling scared of their health challenges and sorely in need of advocates and time with their physicians and doctors. The personal relationship is underestimated in relation to its overall importance in the recovery and stability of people's health. If a physician doesn't take the time to listen to and reassure their patients, the recovery process is inhibited. When I was 8 years old, a physician of mine informed me straight-faced and without any level of compassion or sincerity that I needed a spinal rotting and that it was potentially life-threatening. For an 8-year-old kid who just wanted to play Pokemon and hang out with his friends, this was life-shattering. Experiences like this have opened my eyes to the importance of a good relationship and personal connection with doctors, caregivers, and patients. When the residents from the U of M came to visit with me, each of them were thoroughly on board with this notion of a strong personal connection. It's reassuring as these will be the doctors of the future, and it's good to know that the patients of tomorrow will be in good hands. I know that cost-cutting initiatives are putting time constraints on residents and doctors alike for their interactions with patients. However, effective patient care coordination is really crucial to recovery and stability of health. The relevance of a personal connection must not be underestimated. Human health care is as much a science as it is an art, full of challenges and doubts, yet with the human element, touch, and care, all is possible. Thank you for listening.